Hi there, this is Kishore Mohan and welcome to my YouTube channel. So today's category will be on health and I'll be talking about acupressure therapy for headache, cold and migraine. So let's get into the video. So acupressure. What is acupressure therapy? Basically, acupressure is a alternative treatment or it's a therapy method to relieve pressure or cure certain diseases using or stimulating pressure points in our body. So what are these pressure points basically? Pressure points. So we know our body is full of nerves, nervous system, all these lines running through all our body. So these nervous points or these nerves ending are all over the body. Is an example our hands, palms, legs. So these nerve endings. So whenever you stimulate these nerve endings or also called as pressure points, there's certain changes in your body like that is called as bioelectricity. The flow, if it is blocked, there's certain diseases or certain like pain, headache which happens. So when you relieve these pressure points or when you stimulate these pressure points, the pain or the particular disease gets cured or you have a relief. This is based on the bioelectricity in our body. These the what I said is bioelectricity or the energy flows throughout our body, and these lines are called as meridian lines. So these lines run throughout our body, and there's certain pressure points in our body, in our face, like I said, hands, palm. So basically, we trigger these points, and this is called as acupressure therapy. So you might be asking me, Kishore, so what research backs up this acupressure therapy? Is there any research done or studies done for this? There are a lot of research and studies done on acupressure therapy. So few I have come across and two I found interesting. So one of them is a study was conducted in 2017 on sports person. So basically after a sports session or a game, the sports people were divided into two groups. One group received acupressure therapy for relieving their pain after sports, obviously, So another group had placebo or no acupressure. So basically, acupressure or no placebo is nothing. One group is a control group where we don't do any acupressure therapy or any other kinds of therapy. Other group had acupressure therapy for 3 minutes. So what we found was that after the therapy, these people had their pain was relieved drastically. That was the research found. Their anxiety was not relieved though, but the pain in arms and shoulder was completely relieved. So that was one research. Second research was it was done on cancer chemotherapy patients. So after chemotherapy, people had a lot of vomiting sensations, tiredness, and all those things. So again, they were divided into two groups. Post chemotherapy session, the acupressure therapy was done on one group of people and one group which didn't receive acupressure therapy. So the people who had acupressure therapy did not get vomiting signs or tired sickness. So they felt better after acupressure therapy. So these were two research studies or articles which I found very interesting. So let's get into the video. Today I'll be talking about acupressure therapy for headache, migraine and cold and sinus. So before that, a small disclaimer or note, people who are pregnant as pregnant ladies, please do not do this, especially if you are over pregnancy over 3 months, do not do this at home. And also for people who have fluctuating blood levels, high BP, low BP, do not try this. Consult a physician before trying acupressure therapy. For headache or migraine, so let's see pressure points for these. So see, just watch carefully. Here, there are a lot of nerve endings. That is, our nerves, brain nerves, come or mainly centered in the thumb region. So for all this whole thumb region is full of nerves connecting coming from a brain. So keep a finger like this, or take a blunt end of the pen or pencil and just do this gently. Like just give a pressure, small, apply gentle pressure for 5 seconds. Then next, can you see here? Just a simple pressure. You can do this with the other thumb or finger like this, all over your thumb. So these basically contain our nerve endings coming from our brain. So this stimulates the brain nerves, whole thumb region. So if I have migraine since like ninth grade, hectic headaches, So I found this very useful for me. Whenever I get headache, I just take my pen or pencil, the back end, the blunt end, and start doing this. A gentle pressure, 5 seconds, 5 seconds. Do not give a high pressure. Gently trigger those points. The whole thumb region. So this is one. Second, there's also points in our forehead. So these points gently rotate with two fingers, clockwise 10 times, anti-clockwise 10 times. Then this region also has our brain nerve endings. So again, clockwise 5 times, anti-clockwise 5 times. Or you can do 5 to 10 times. So this thumb region completely, and this point and the forehead point. Do this for 1 to 2 minutes, not more than that. So 2. For cold and sinus. So the cold, the nerve endings are here in this region. This top, not this bottom, the first half. This region has our cold nerve endings. For sinus, the endings of our fingers, the tips, these tips, okay, can see this. So again, take a blunt region of the pen or pencil or your finger or thumb and just push gently. 5 seconds. Or you can even do like this. No issues. For 5 seconds, gently, the whole upper region of this finger. Yeah, I mean all the fingers. All the 4 fingers here except the thumb. We can keep on doing this for all these regions. 5 seconds each push pressure. Both the hands. Do this for both the hands, all these four fingers for 1 to 2 minutes, not more than that. For sinus points, I told you the tips of the fingers. So you can just do like this, much easier. Or again, take a pen, blunt region, just 5 seconds, slowly. I felt this is much easier. Just do this, like small gentle pressure. That's it. Okay. So it is in our palms. So also remember these nerve endings also goes through our the leg region, that is the foot region. But you don't have to raise your leg and do it. If somebody is there, it's fine. So just use a palm. Okay. Then for cold and sinus, again there is a pressure points near your nose. The 3 pressure points. One here. See, in the starting of the nose part. Gently keep your 2 fingers like this and just gentle pressure and rotate 10 times clockwise, 10 times anti-clockwise. Then the middle region of a nose, the corn, the ending here. Again, inwards, outwards, 10 times each. Then again, this region, the ending of your nose, near the nostrils, slightly. Inwards and outwards. So while doing these pressure points, breathe normally, sit in a calm calm region, calm area in your house, concentrate and do this just for 5 to 10 minutes, covering your finger like head region, for cold sinus points. Just do this and do this in an empty stomach or like 2 hours post your lunch or dinner, whatever it is. So you can do this twice a day, morning and before your dinner. So just do this twice a day, not more than 5 minutes. No, not for pregnant ladies or people with high blood pressure, low blood pressure. And this usually cures very good for people who have mild or minor symptoms, not in a very advanced stage. For that, please consult your doctors. And yeah, I'll just give you a reminder how to do this again. Now I showed you pressure points. I'll just show you how to give the pressure and how many time, like water. So this is your point. Gentle pressure, 5 seconds. The next just all over the finger. 5 seconds. Gently. We will just try to stimulate the nerve endings. Remember that. The bioelectricity in our body just gets stimulated. So that's how you do it. Do not force it. Gentle. Also, I'm not a physician. So consult your physician if you have very what to say disease for a long time. Ask consult a physician before doing this acupressure therapy. For people who like us who like general headaches and cold, this works out beautifully, and it has worked for me for my migraine. So that's it, guys. Hope this video is useful for you. Take care, bye bye, and hope you wish you a good health. Bye bye.